tested, I had no symptoms of prostate cancer and had no reason to believe that I had any particular challenges.
So that was Simon Jordan talking about his recent diagnosis of prostate cancer. And first thing to say is, Simon, I hope you make a speedy recovery. It's great that he's been so open about his diagnosis and his surgery, because it means that we can talk about it, because guys are really bad at talking about medical things anyway. The prostate is a little gland that sits just underneath the bladder. So if you look inside on, you can see it just here, just underneath the bladder. The urethra, the tube that you pee down, comes out of it. And if you look at the top, that's what it looks like from a front view. So you can see your pee tube running down the middle of it there. The prostate has important functions. It produces enzymes for sperm so that it can travel where it needs to go. It also contracts during ejaculation to make the sperm go further. Obviously, it's just a gland found in men. Prostate cancer is caused by androgens, with the biggest androgen being testosterone, and then you've got dihydrotestosterone, DHT, and both of these act on the prostate and cause the cells to become dysplasic and eventually malignant, turn into a cancer. Prostate cancer affects about 1 in 8 white men. The risk is much higher for black men. It's 1 in 4. Simon Jordan himself said he had no symptoms, but the symptoms that you might get, if you imagine where the prostate is, it can push on a bladder. So you would get things like not being able to go to the toilet. You might have a poor stream when you pee. You might feel like you've done your pee and you need to go back again. You might get some dribbling after you pee. You might have to get up in the middle of the night like 5-6 times for a pee. And a rare one, although we see it sometimes, is blood and semen. Now, every man's prostate gets bigger as they get older. That's called BPH, benign prostatic hypertrophy. And the symptoms are very, very similar, whether you've got a big prostate or whether you've got a prostate cancer. The first test that we do is something called a PSA. That stands for prostate-specific antigen, and it's only produced by cells in the prostate. This is where it gets a little bit more complicated, because depending on what age you are, depends on what number that we accept for this PSA. If you're in your 40s and it's very high, then we have a real suspicion that you might have a prostate cancer, and so you would either go for a scan or a biopsy or repeat it again in 6 months. If you repeated it again and the number was very high and it doubled, then we'd be worried that you had a prostate cancer, and you'd be referred to a urologist for a biopsy and possibly some surgery. There are different types of surgery that you can do. You can actually remove the full prostate, or you can remove part of the prostate, and those are done quite differently. Can screen people with a prostate-specific antigen, a PSA, but like screening, it does come with its problems, so you get false positives, and it gets a bit complicated. It is a very good test. So if you know anybody who's been having some of the symptoms that I've been talking about, get them to go and see their doctor and consider doing a PSA.